mental health. We all are talking about mental health, especially from last 1.5 years a lot. And I'm a mental health care professional, known as a marriage and family counselor more in Delhi NCR and in India. So mental health, we are all talking from last 1.5 years or 18 months after especially this pandemic about mental health. Now each and every person is concerned about that. As a mental health professional, I worked during the COVID times. I'm working and I will say lots of patients I attended this particular times when they have anxiety, depression, marital disputes. Just give me my life journey bit of in 2-3 lines so you may correlate. I myself is the mental health survivor. I had a history of domestic violence. When I'm using word domestic violence, hitting with chappals, legs, hands, numerous occasions, numerous times for small things. By my brother and mother on numerous occasions, and I had faced domestic violence by my husband, ex-husband also. Again, putting my heads on walls, not once, numerous incidents. Once I had 7 stitches over my forehead. So I am myself as a mental health survivor. 15 years back, I left my home because of my mental health. Because my brother and mom had some, you can say, paranoid tendencies, which we can say, that they had a doubt I'm a characterless girl. Sorry to say that, but it's a reality of the life. Maybe I had different terms because I was a career oriented. Now in different terms, they say my career is more important than anything else in the world. So when you talk about mental health, as I was saying that, it is basically about what you think, what you feel and what you act. All things you need to be taken care of. And when you are talking about mental health, if each and every person is aware about their thoughts, then the answer is maybe. We say that lack of self-awareness is lot of public is facing this problem, not only in India, all over the world. And pandemic was that time when people were not able to go out of their houses, and then the journey was towards inside. They actually realized that this was the situation of a time of uncertainty. And with uncertainty time, most of the people in the world are not comfortable. They don't know what to do in this particular timings, how to handle the situation. And lots of people have panic attacks, anxiety, depressive symptoms because of that. And when such scenario comes, what sort of cases? I will just say that people who are not able to allow go out of the houses. I remember one of my clients called me up and said, "Doctor, please issue a pass. I'm having panic attacks. I want to see you in the clinic only." I remember I issued a part and the clients came to visit me during that April's month of last 2020. And I'll say people, the partners were not allowing them going out of their houses, that having each and every product they were using in the house by washing their hands for each and every time. So you can spend, in technical terms, we called it too much of OCD. As we know that washing hands was very frequent thing, and because the precautionary measure, it was being used from last more than 17-18 months, a lot. But the basic thing is, when we are talking about mental health, it has proportionate impact on our physical health, our emotional health, our financial health, our spiritual and social health. Pandemic was the timing when people were not able to go out of the houses, and that's why we were into a limited spaces. Some people were introverts, some people were extroverts. I'm just sharing one client's case where he just shared this with me. 16 years old guy, he's an introvert guy. He was not sitting with his families. Used to be sit in his own room. And definitely it is one of the influential family of Delhi. And he said his father hit him with chappals because he don't like to go out for shopping. He doesn't like to interact with the family and just talking because he's very precautious about, you can say, physical health. The smaller, 16 years old child. So you can understand, I'm not blaming the parents, but I will say these parents are themselves not self-aware. They're themselves not aware about what they are doing it. Same vice versa. I remember one client I attended where they had an infidelity issue, where the female lady had an affair earlier and the husband was saying, now she's on social media every time. Each and every comment she's posting likes. I don't know, I'm not hating social media, but this is the complaint was the partner, that my partner is spending too much time on phone and lesser interaction with the family and the, I would say, similar complaint by female patients of mine. They talked about my husband is spending more time on social media. Earlier there was an infidelity, but it's very lack that we are not able to make the bonding. And there were the couples. He said that there is a large amount of improvement in last 1.5 years of their relationship where they have lot of compatibility issues. Now when the pandemic time comes and such problems came to me, what I did as a professional, what I suggested to them. I'll just give you an example of mine. I'm self-aware. I'm dealing with the patients who are suicidal tendencies. I'm dealing with the patients who lost their family members. Don't think of how to move ahead in life. My life is all around that. Like the way I said it, that I never thought of buying a 5 rupees pen 15 years back when I came to Delhi with 20,000 bucks of my pocket money. And today I'm in front of you. I remember there was a time that I used to listen for my brother. I'm a dumb, I'm a slow learner. I listened all this for more than 27.5 years. And my husband told me I don't know how to speak English, how to talk, because I'm a Punjabi background. So you can say there is a little bit of Punjabi like tone or is there in the talking ways. So, but I know one thing, that if you have some dreams, you can fulfill those dreams. And I'm telling you, from a person having no background of my family doesn't, maybe I was a hard worker, very dedicated student. So maybe family got somewhere convinced I have to do my PhD. I have to convince them somewhere how I did a job for 5 years. Maybe I can say that even my parents listened a lot, because 5,000 rupees job I did for 365 days in a year. And that much the car petrol was that cost then. And I know that they listened a lot because of me, because I'm an open-minded person. I don't do judgments, not as a person or not as a professional. But the basic thing is, when we interact, all of us interact in the outer world, we meet the people with a lot of judgments. They make judgments about you. Why you are doing this? There must be something. Like if you, in India, the culture is like, if girl is smiling and talking to a guy, like hasi to fasi, in 90s you know that if you say no to a boy, at that point, the boys used to think the girl is saying yes. So you can understand that even at that time, all the songs were of that time was all that if the girl is saying no, it means yes. But I will just say that from my childhood, I was very self-aware. If I don't like someone, I tell I don't like. The word boundaries we talk about from last 1.5 years a lot on social media. That word I was aware from maybe I was 10 years old. I remember one of our uncles used to come inside the house and used to touch us on the back. I told my mom, this uncle is touching me on the back, I don't like it. My mom said that this is his habit. I said, it is his habit, it's okay. But I don't like his habit. So you can understand that this comes under the physical boundary. When you don't like someone's touch, you can say no. So you can imagine that when a 10 years old child has an awareness, what is a good touch or bad touch, not being taught by the parents, but it was self-aware. Maybe my both parents were highly intellectual, but they have no awareness about mental health. This was the fact. As I saying that in my life journey, I have seen violence a lot. My brother used to break things at home. We all face that when we go outside the houses, that our friends wore good shoes, you are studying, comparing yourself. I don't have a car, I have not have this car, I have not have this brand shoes. There was a fight he used to break things at home. I have to go for a trip, why not parents are giving me money? So smaller things he has to lose to fight a lot, and I was most of an observer child. I'm still observant a lot. What is the observation skill? It's about using your 5 sense organs. We're talking about listening, but we don't talk about observation. Observation is you listen fully. You not only listen fully, you see fully, you feel fully. All those sense organs you are feeling, sensing, 5 sense organs. When we maximize use that, it comes under observational skill. Even Nixon is also one of the part of observational skill. So when in the pandemic times, the clients came and visited my clinic, or maybe I had lots of clients over the call or online medium, I talked on what you feel. Giving an example, if 5 people at home are tasting one dish, you don't like it at all. It's okay. Other person like it at all. It's okay. Neither you are wrong, neither other person is wrong. Maybe your taste buds are different than other person. And this is all about self-awareness. This is all about mental health. Accept yourself the way you are. This is all about mental health. When you say is that you accept your personality as it is. You have flaws, accept your flaws. You don't know anything, accept you don't know anything. And this is the problem lots of people face. They can't say no. They have a problem in saying no. Not only saying problem in saying no, they have a problem in asking for help. And that's the first sign of, another sign of mental health. You know your limitations. When you know your limitations, you say no. I have this limitation. I can't do this thing more. I can't take more. Maybe giving an example, as a mental health professional, I was not watching TV news. The major reason was that I was dealing with the clients on daily basis. And I'm listening all stories, their sad stories. Somebody banged their head at home, they had a fight, somebody tried to cut their nerve. So you can talk about how much emotional journeys, why people do self-mutilation, because they are unable to take the emotional pain, and to cut down that emotional pain, they physically hit themselves sometimes. They cut the different body parts. I dealt with lots of patients during even this last 1 year of pandemic, where they try to cut on their shoulders, they try to cut on their thighs. So you can imagine how much pain they all go through. So pain is also one of the part of the mental health and the process of emotional health or a mental health journey. Like you need to accept. I don't know how many people know about this thing, that when you are asking for help, it means you need a support and you want to connect with others, and it's a good sign. And when you are communicating other people, you can't do this more, you need a help. Like someone says, I need medicine. It's okay. It's okay the way you are, perfectly. If you are overweight, it's okay. If you are dark in color, it's okay. If you are short in height, it's okay, whatever way you are. The moment you accept yourself, all things are fine in place. Give an example, if a couple comes and the husband says, I am unable to have a physical intimacy with my partner. We are trying from 10 years. I said, it's okay, let it accept it now. Why not be a quitter? I am not able to do this. It happens most of the time in life. We try something hard, it's not working it out. And that's why sometimes people think of a plan B. Plan A is not working. And sometimes we like something, we want to do something. But maybe we are mentally, physically, emotionally not prepared for that thing. And we have to accept our limitations. It may be our life problems are like a 1 liter of water bottle. And our capacity is only 200 milliliter water. So what to do? The only thing is we need to rejuvenate our energies, whether by physical workout, whether by taking positive or creativity form. You can channelize your negative energy into creativity. Another form is that you get indulged into not only into hobbies, you share your problems with the people who understand you. And if there is no one to understand you, we therapists, counselors, psychologists are there to help you out, to listen you. And definitely, psychologist, therapist, counselor's job is not to hear you, to guide you. It would be introspection and retrospection, to give you reflection where you are going wrong, or maybe where you need to address those issues. Maybe your physical health need more rest, your mental health need more rest. Like the way I said it, if somebody is saying no, and I think so lots of time when housewives called to me or spoke to me and visited me, I told them, you are not able to do things, you are not able to cook food, tell them, I can't able to do it more. It's okay to accept I can't do it more. And the moment you love yourself the way you are, the whole world will love you. And definitely, if people will not love you, at least you will be comfortable in your own skin. And once you are comfortable, I think so you will get peace, which serenity, calmness, which we are looking for. Maybe somebody like calmness by singing a song, somebody find calmness having a cup of tea, a simple cup of tea, or a green tea, or whatever, a coffee, whatever you like. Maybe going to a fitness club. It will also give you a calmness. Let's do that, whatever you want to do that. But I would just say, do those things which makes you comfortable on all the front. Mental, physical, emotional. Don't do things just for the sake of others. Just think about yourself. People may call it selfish. People may call you individualistic. But if you are not happy, you can't make others happy. And once you are happy, you can make others happy even by going out of your comfort zone. So that's why I said it. The boundary word is taking care of your self-care. It says that need is prior than want. So self-care is or self-love is a need. And need is always prior than want. And self-love is a need. So when we talk about self-love or self-care, we talk about boundaries. As I said it, one word is about physical boundaries. I don't like this touch. I don't like you comment on my physicality. Maybe I'm looking sexy. Maybe I don't like the particular way you touch me. So that comes under physical boundary. There is another boundary, emotional boundary. When you talk with your friends, to talk to your family, you say that, I'm not comfortable talking about this particular topic. Can we stop this right now? Or maybe I am right now working, you don't disturb me this time. So it's called emotional boundary. It's basically particular field we use it to take care of our emotions. We don't want to take care of our mental health. We don't want to I will say, de-escalate the situation, or we want to put ourselves on calmness and comfort zone. Then let's talk about mental boundaries. When we interact with our family, friends, or the people in our surroundings, our opinion doesn't match with them, and they try to oppose their opinion in you. And then you can take, again, stop. Don't do that. My opinion differs than your opinion. It's okay. You may feel that, I may feel that. So it may be difference of opinion. Maybe from one angle it looks like 6, from another angle it looks like 9. And no one is wrong in their own ways. But there is a acceptance of other people's emotions. So that's called mental boundary. There is another called material boundary. Lots of people are very, I would say, personal about their things. You can't touch my towel. You can't take the food from my plate. It's okay. It's okay to set that boundary. You don't like it, you can communicate it. And the people who take care of these boundaries, they are not wrong. Neither they are mental people. They know what makes them comfort, and they are taking care of that particular things. So when we are talking about, as I said it, the mental boundaries, physical boundaries, emotional boundaries, material boundaries. All these boundaries we need to take care. And if we are in trouble and we have the thing that we are in pain, sometimes because people only understand the emotion word or pain when you cry, when you talk about your problems. I think so. If you increase your observational skill, like the way I said it, soothe your 5 sense organs, because we say that lack of self-awareness is one of the major cause in relationship. Like, as I said it, sometimes I get clients who says there is a lack of intimacy in the relationship. It means they are maybe emotionally not comfortable and they are not aware about at all. And once sometimes they are aware, they purposely suppress their thoughts, because they know that if they talk about their comfortability or their comfort zone, the relationship will be no more exist. So that's why some people not talk about that. Sometimes person is not aware about, maybe he's looking for emotional comfort mode. Maybe he's looking for gratitude mode. Thank you, sorry, appreciation, small gestures make the relationship very stronger. And this is what I realized it. I remember yesterday I was dealing with one client. He said it to me, my wife never appreciates me. The vice versa, the wife was saying it because she was comparing her husband with another members of the family, maybe his own brother, maybe his sister-in-law's, basically. So sister's husband. So all these things sometimes we feel comparison and we don't appreciate each other. And when we don't appreciate, definitely the problems comes. We all look for appreciation. And the people who don't appreciate, they themselves not got appreciation in their life. So I will just say that. Love yourself the way you are. Appreciate yourself on daily basis. Because if you appreciate yourself, you love yourself. Definitely you love others. Because happiness, mental health is not only about you to comfort, to others to comfort also. So it's a journey of I versus we. So the basic thing is, if you have, I want to say, life is a bed of roses, and roses are never without thorns. So life is all about adjusting with thorns along with the